What happens when you stop washing your face? In today's video, we're going to talk about those unicorns out there who allege you don't need to wash your face. They haven't been washing their face for the past year and their skin has never, ever looked better. Beware the unicorns. Sometimes there are anomalies out there. Is there any benefit to just abandoning cleansers? Like, is this some modern thing that brands have convinced us we need to do to wash our face? Like, shouldn't water alone be enough? What happens when you abandon facial cleansing? Does your life get better, easier? Does your skin suddenly go back to how it looked when you were a baby? No. People who claim that they don't wash their face and that their skin has never looked better, probably not lying. There are people out there who can get along without using a facial cleanser. There are people out there who can just splash water on their face. But for a lot of people, that's not gonna work and it's gonna lead to skin problems. Oil from your sebaceous gland accumulates. When you go out, you're exposed to ultraviolet radiation, pollution. Those things can oxidize that sebum on the skin surface and create an inflammatory cascade of events that can trigger acne flares for some people. Sebum also is the food for that pesky little yeast that lives on everyone's skin, Malassezia. So when you have a lot of oil on the skin surface, a lot of oil collecting in the pore, that little yeast thrives, it breaks down the sebum and generates a cascade of events that brings in a lot of inflammation and can trigger different skin problems for you. On the face, that often will appear in the form of something called seborrheic dermatitis, which is related to dandruff on the scalp. Seborrheic dermatitis consists of these patches of red, flaky skin, kind of with an overlying greasy yellowish appearance, most often concentrated around the brows, the sides of the nose. But truthfully, seborrheic dermatitis can actually appear on any body site where you have hair follicles. And a lot of people develop this. They don't know what it is. They'll try a lot of different remedies. And honestly, consistent cleansing can definitely help the condition out by removing that excess oil off the skin surface that otherwise, feeds into the Malassezia. The other skin condition that I get tons and tons of questions about and is really, a highly searched topic on the internet is something people refer to as fungal acne. That's not actually the correct term, but that's what the internet seeks out information on. The correct term is Pityrosporum folliculitis or Malassezia folliculitis, however you want to name that yeast. That yeast that I was just talking about, sometimes it can really thrive and jive in the follicle and lead to an inflammatory reaction that looks like acne. You get these little bumps that are itchy, often on the forehead, but truthfully, it can happen anywhere. We see it more often in people who live in tropical, humid environments, people who have oilier skin, and we often see it in people who have underlying problems with their immune system or are on medications that either disrupt their immune system or disrupt their skin microflora, namely prolonged antibiotic use, for example. This can trigger Pityrosporum folliculitis. Folliculitis is just a medical term for inflammation around the hair follicle, and there are a ton of different causes. So in the case of what people are calling fungal acne, it's actually Pityrosporum folliculitis. It's not acne. Then the other condition that a lot of people deal with is tinea versicolor. Very common condition in humid climates, but people who have oily skin, people who sweat a lot, work out in the gym, they're prone to recurrences of this. Again, it's related to that little yeast that lives on everyone's skin. This time, instead of little bumps that look like acne or instead of greasy, scaly patches, instead you get these little patches of skin that sometimes are dark brown with overlying fine scale, and then most noticeably, those little patches lose color and they become hypopigmented. And this condition comes and goes, tends to flare in the summertime, but if you are really oily or you're not washing your face on a regular basis, it definitely can support recurrences of tinea versicolor, and it can appear on your face, like often, on the sides of the face. These conditions all can be aggravated by not washing your face regularly. Now, not everyone has these conditions. There are those unicorns out there who will just splash water on their face or barely even do that and be perfectly fine. But not everyone is the same. A lot of people genetically have oilier skin, larger oil glands. Other things about them that we have not fully understood scientifically speaking make them more prone to these skin conditions related to that little yeast. And consistent cleansing is really important for controlling those conditions and preventing recurrences. So those are all conditions related to that yeast, who's going to have a grand old time if you just stop washing your face, especially if you have oily skin. The other folks who, may experience problems when they decide, hey, I'm going to bail on my cleanser, are people who have acne, because people who have acne, they tend to have oilier skin. Their oil glands tend to make more oil. And again, that sebum can oxidize on the skin surface. The acne-causing bacteria, Cutibacterium acnes, feeds on that excess oil, breaks it down, and again, creates inflammation in the pore, leading to, flares of acne. You also have pore clogging with acne, true acne. So at this point, I've covered the little yeast that lives on our skin. I've covered the acne-causing bacteria, and why cleansing to remove excess oil is really important for controlling conditions related to this. But there is another little part of our natural skin flora that definitely can cause issues for a subset of people. Those of you out there with rosacea, listen up. There is a little mite that lives on everyone's skin. I mean, it really freaks people out, a little freaky to think about, but we do have mites that live in our hair follicles, on our face, and in our scalp. They're called Demodex. And for people who have rosacea, those Demodex mites are thought to play a major role in the formation of what are called papules and pustules, basically little red bumps that can be filled with pus. That's a pustule. A papule is just a bump. A pustule is a bump filled with pus. And people who have rosacea, they're known for having a background of facial redness, flushing, but they also can develop these little almost pimple-like spots, and a lot of that is thought to actually be related to an inflammatory response against Demodex. Now, Demodex, they don't necessarily thrive on your oil. To a certain extent, they like to snack on that, but they really like dead skin cells. So part of the benefit of cleansing is that you are, in effect, helping to exfoliate the skin, helping to dislodge shedding corneocytes from the top layer of the skin, smoothing out the skin surface. When you don't cleanse consistently, that can build up and serve as, a food source, if you will, for Demodex. By consistent cleansing, you help to cut down on the burden of those Demodex mites. Now, whether or not it's the mites themselves, or there's actually a little bacteria that live on the mites. And it's thought that for people who have rosacea, they're inflammatory, they have an abnormal inflammatory response to maybe the bacteria on the mite. People who have rosacea, if you biopsy the skin lesions of rosacea, there is a higher burden of Demodex mites. Cleansing consistently can help cut down on that. Other things that help cut down on that for people who have rosacea are the medication Cilantro, which I have a video on. It's topical ivermectin. You also have azelaic acid. Azelaic acid is a topical treatment that is anti-inflammatory, and it's also antibacterial, so it may help with the bacteria that live on the mite. And azelaic acid also mildly exfoliates the skin. So it's, it has definitely been suggested that part of why azelaic acid is helpful for people who have rosacea is that, maybe it helps with the burden of those mites. There's even some thought, though, that those little mites may also be playing a role for people who have acne. It's kind of a theory. It hasn't been fully established yet. But all I have to say, consistent cleansing really helps keep the burden, the volume, if you will, of those mites in check. Now, when people hear about these mites, they get laser focused on how to eradicate them. You don't want to eradicate them. Anything that's part of our natural flora is a good thing. It's more about not tilting the balance in any one direction. So it's not like we want to eradicate these mites. They're naturally supposed to be on our skin. Like I said, they have bacteria that live on them, which may be helpful for the biology of our skin. So just, if they're not causing you any problems, try to not think about them. But for people who have rosacea, they become, a problem. They overextend their welcome, if you will. They get a little too comfortable. There are too many of them, and there is an abnormal immune response against them. The other thing that is kind of a delicate balance when it comes to facial cleansing is you're balancing removing stuff on the skin surface like oil, cosmetics, sunscreen, debris that would otherwise generate inflammation in the skin and compromise barrier integrity. And when barrier integrity is compromised, you get more water loss and you get more penetration of irritating things. However, one of the issues with cleansing is that no matter how mild the cleanser is, it in and of itself, the act of it leads to some amount of barrier disruption. So here comes the situation where abandoning cleansing for a limited time may actually be beneficial. And that is it with people who have any type of eczema on the face. Eczema is just an umbrella category for a bunch of different skin conditions where a lot of times you have a problem with the skin barrier. And when some of those eczemas get really inflamed and severe and the barrier is really impaired, you may be encouraged to lay off of the cleansers because the barrier, can't hack that. So that might be a situation where, your friend may say, I went to the dermatologist for this thing I've got on my face and you are not going to believe it. They told me to stop washing my face. That doesn't mean you need to stop washing your face though. You know what I'm saying? Like that person had a condition that would benefit from a short-term break away from cleansing. Doesn't necessarily mean that everybody needs to abandon ship when it comes to the cleanser. Now, if you have eczema, don't just think that you need to abandon your cleansers automatically either, because we know that for eczema, using mild cleansers actually for a lot of people is really important for cutting down on flares, because consistent cleansing, again, helps to a certain extent. Actually, I know it seems counterintuitive, but it can actually help with barrier function by removing some of those shedding corneocytes that are kind of stuck, as well as removing aeroallergens, pollutants, debris, sweat, a common trigger for eczema, although sweat is water soluble, so you may not necessarily need a cleanser to remove that. But all I had to say, like cleansing with eczema, namely atopic dermatitis, it definitely has a role, but when things are really flared up, don't be surprised if your derm encourages you to lay off of the cleansers for a while, because it can help with barrier restoration. But what about these unicorns? Coming back to the unicorns though, what about these people who claim they don't wash their face? They definitely exist. There are definitely people out there who go through life perfectly happy and content. They don't have any skin issues and they don't use a facial cleanser, and all they do is, get their face wet in the shower, and that is more than adequate. From a hygiene perspective, that probably is fine for a lot of people. It's not as though your face is constantly being exposed to things that can make you sick, like the skin on your hands that carries pathogens. People tell me they don't wash their hands. That I really side eye and worry about, their health for that reason. Hands transmit stuff that makes us sick, either you sick or, somebody you come in contact with. Hand hygiene is a must. Hand washing is a must. But, if somebody's like, I don't use a face wash, I don't wash my face, I just get it wet in the shower and I don't have any problems, I'm like, great, one less thing you have to buy. But that doesn't mean that everybody can go on that path. If you wear makeup, you're gonna need a cleanser. Water alone is not gonna remove makeup. If you wear water-resistant sunscreen on the face, water alone is not gonna remove that. And if you have a film of sunscreen / cosmetic residue on the skin, it can be pretty irritating as it starts to break down, and that can cause skin problems for you. So removing that with a cleanser at least is necessary. Now, the other group of people, if you will, that really don't necessarily need to use a face wash and probably don't want to use a face wash are people in the age range of 2 to 5. Little kids, they don't like stuff coming in contact with their face. If you are a caregiver for a little child at that age group, teach them how to wash their hands first and foremost, but they really don't necessarily need to be using face wash. A lot of times they get away with, just using a washcloth and wiping their face off, and they're fine. They're not having skin problems. But once you get into the preteen years, the tween years, the teen years, you're having hormonal changes that feed back to the oil glands, and you start making more sebum. That's why things like dandruff, seborrheic dermatitis, acne, they all start to appear around these age groups. So then cleansing becomes more important to you and more important in your skincare routine. Of course, like I said, there will always be those unicorns out there who just don't really need to do any kind of face washing and they just use water. But again, that's not going to be right for everyone. People who have underlying skin conditions conditions, talk to your dermatologist, because a lot of skin conditions, many of which we've touched on here, really do benefit from consistent use of a mild cleanser. And as you're following up with your dermatologist, you know, if problems are arising secondary to cleansing, maybe you're allergic to something in the cleanser, or you're cleansing too much, the cleanser is harsh, you know, you can kind of get that feedback from them. How many times a day do you actually need to wash your face with a cleanser? I advocate once a day at the end of the day. Some people who have very oily skin, however, they actually benefit from washing their face twice a day, morning and evening. I actually wash my face twice a day, morning and evening. I don't necessarily have very oily skin, but I find that I like washing my face in the morning. I'll go through periods of time where I don't though, and I'm no worse for wear. The other reason cleansing is beneficial, if you're someone who wants to have a skincare routine, you're looking to incorporate active ingredients, cleansing really helps ingredients penetrate the skin in a more even fashion. Because you cleanse, that helps remove excess sebum from the skin surface. It also helps to kick off some of those clumps of corneocytes that are trying to shed. So you have a like nice, even, smooth surface. And usually you apply your skincare products like serums shortly thereafter, after you've rinsed the cleanser off, while the skin is a bit more damp. So it's a lot more accepting of ingredients penetrating in. So you may be getting better results from your skincare by washing your face first with a mild cleanser to remove the oil. You know, if you go and have a chemical peel, the dermatologist is going to have you wash your face, and then they're actually going to take an alcohol prep pad, which I don't advocate you do as part of skincare. They're actually going to take like an alcohol prep pad and degrease the skin as much as possible to just get rid of any oil on the skin surface, so that that peeling agent really can get on in there. Not something you need to be doing as part of your skincare routine, because consistently doing that can really irritate your skin. But all that to say, like, that really speaks to how we know that the sebum on the skin surface, the dead skin cells, they really can, you know, kind of get in the way of stuff penetrating. Now that can be a good thing too. A lot of things are not so great when they penetrate our skin. They're irritating, they burn, they sting. So for people who have sensitive skin, they have symptoms of sensitivity, burning, stinging. A lot of times people with rosacea are in that category too, because rosacea, you have a heightened sensitivity to things coming in contact. Over cleansing and barrier disruption can worsen those symptoms of sensitivity, those findings, redness, itch, pain, discomfort. So if that's what you're developing, then you may want to go back down on the frequency, or look to a cleanser that is super mild, like a creamy cleanser. I'll just use two examples of cleansers for you guys, because I really do think that these cleansers are kind of on polar opposites, and really are, you know, sort of meeting the needs of two almost extremes of skin types. The La Roche-Posay Toleriane cleansers. There are a ton of great cleansers out there. These are just two that are coming to my mind as I'm sitting here filming and talking to you guys. The La Roche-Posay Toleriane foaming cleanser, that is one that for me personally, I find if I'm washing my face twice a day with that, it's almost like a little bit too much, the degreasing aspect, and I find I end up getting a little dry. Whereas they have a creamy cleanser in that same line that is great if you have very dry, extremely sensitive skin, have the least impact on your skin barrier. The creamy one is actually really good. Now, there are tons of other facial cleanser brands out there that have cleansers at these extremes, like Cetaphil, for example. They have a daily facial cleanser that is formulated more for people on the oilier side of things, and then they have a gentle cleanser that is creamy and very, very mild, doing kind of the bare minimum in terms of helping to remove stuff, but not, you know, not dinging around at your barrier much. So that's really where you kind of have to play around a bit in terms of what your skin needs. All right, but if you forget to wash your face one day, is it going to fall off? Are you going to develop acne, breakouts? No, the timeline of skin problems is not that acute related to facial cleansing. It's the kind of thing where over time, slowly, these things will start to become a problem if you abandon cleansing altogether. But, you know, if you are in a hurry, you forget to cleanse one day, you fall asleep in your makeup, your face is not going to fall off. It's just not a good habit to get into for the most part. The other situation I get a lot of questions about is like people who enjoy camping. They may be in somewhere where they don't have access to clean water to wash their face. Micellar water can actually be pretty helpful in those situations to remove sunscreen. All right, y'all, that's what I wanted to talk about in today's video. Because I always see these TikToks and things of people who, encourage everyone to just abandon their skincare, stop washing your face, stop washing your hair. Yeah, I think I've even seen some guy claim that he'd stop brushing his teeth and, trying to convince other people to do that. Please don't do that. The consequences of not brushing your teeth are much graver than the consequences of not washing your face. In terms of dental caries and problems with the health of your gums, yeah, definitely brush your teeth. It is not some, modern conspiracy to get you to waste money. One last thing, because a lot of these posts that, kind of try and encourage people to abandon things like washing their face, they'll always kind of make this claim that, our ancestors did not use any of these things, and so we shouldn't. But our ancestors did not have access to these things. They probably, had a lot of skin problems. We know this. There's documented evidence that people dealt with all sorts of skin problems, fungal infections. I mean, you name it. Just because they didn't really have the modern cleansers that we have today does not mean that they were free of skin problems. In fact, they probably had a lot of skin problems related to all of these things we talked about today and really suffered with them. So we don't need to be there. We have advanced. So don't just feel as though abandoning cleanser is something that you should do because Cetaphil didn't exist in Little House on the Prairie days. All right, y'all. I hope this video was informative to you. Let me know in the comments below if you are a once-a-day cleanser or a twice-a-day cleanser, or maybe you're the unicorn out there that just splashes water on your face. More power to you. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.